Good afternoon. To all that are listening, thank you for your attention. My name is Monique Minavini Hull. My student number is 195896997. I would like to introduce you to David Nazal, who is a 62-year-old man with no known allergies. As clearly explained by Curtis 2023, COPD stands for chronic pulmonary disease. Even though the disease is not reversible, it is treatable through managing the clinical manifestations to the individual can live life to the fullest. An exacerbation is simply symptoms having an increased severity. Yang et al. 2017 very simply explains that bacterial or viral infections are the cause of COPD exacerbations. Mr. Nazal has contracted COVID-19, and that has led to an exacerbation of his COPD. At presenting to the hospital, an A to E assessment was performed. To say Mr. Nazal's set of observations are outside of the flags is an understatement of the century. Mr. Nazal is swimming way outside of the flags. As described by Smith and Boehm 2017, ABCD is a systematic approach to assessing a patient. The ABC assessment, through documentation of vital signs, showcases deterioration of a life-threatening state of a patient and the urgency in which they require medical attention. The starting point of ABCE approach is, of course, A, which stands for airway. It is documented that Mr. Nazal, during his exacerbation, does have airway patency and is currently breathing on his own. The nurse on duty would be constantly checking his airway and watching to make sure he doesn't go into further respiratory distress. Airway narrowing and the increase of purulent yellow phlegm impairing his airway would result in nursing interventions occurring to achieve airway patency again. As is indicated by Yang et al. 2017, airway narrowing limits gas exchange. Yang et al. Also details how increased purulent mucus or yellow phlegm can get stuck in the airway. If this occurs, the nursing intervention of suctioning out the phlegm manually would occur. B is next in line, and that's for breathing. David is breathing double the rate of breaths per minute, 30 breaths per minute. As explained by Christensen et al. 27, it means that his lungs have hyperinflation. Due to David's COPD, he has lost elasticity around his bronchial, therefore they are unable to function normally. This has drastic negative impact on his ability to inhale oxygen, which also impairs the function of the alveoli. This has resulted in the lungs being unable to recoil and carbon dioxide not being pushed out, which results in there being no room in David's lungs for fresh oxygen. That's by Leap et al. 2021. There has been direct correlation to David's blood not being continuously reoxygenated, which has led to his blood slowly becoming toxin. Etchefelity et al. 2021 showcases that hypercapnia can be seen in Mr. Nazal's blood gas results, with this elevated PaCO2, which is 60 when the normal range is 35 to 40. Even though Mr. Nazal has airway patency, Cosmo et al. 2022 simply states that he is at risk of hypercapnic respiratory failure. The nursing intervention that which would occur to minimize Mr. Nazal's risk of hypercapnia respiratory failure is oxygen therapy. I would also like to state that oxygen therapy is also a high priority nursing intervention. The blood in our body is like a balancing act. Too much carbon dioxide and you have hypoxemia, hypercapnia, and not sufficient amount of oxygen and you have hypoxemia. Oxygen therapy, in simple terms, adds oxygen to your body through non-invasive equipment. Cosmo et al. 2022 states that oxygen therapy is the administration of supplement oxygen to counter hypoxemia. Now, C is critical to survival, circulation. Mr. Nazal is tachycardic. He has a heart rate of 128 beats per minute. Mr. Nazal also has dangerously high blood pressure, with his reading being 168/85, which is the result of the hypocapnic. It is suggested by Ritchie and Woodson, 2020, that Mr. Nazal's heart rate is tachycardic because of his cardiovascular system is working double time to try and get the minimal oxygen in his lungs around his body. Cosmo et al. Stated that hypocapnia leads to high blood pressure because of the high partial pressure of carbon dioxide in the bloodstream. The nursing intervention for this would be to place Mr. Nazal in the tripod position. Don't be disabled by D, which is disability. David is dysmemy and outside the optionate dyspnea and outside the optimum range of 12 to 20 breaths per minute. His SOP levels are 78% on room air. This reading is disastrously low, which means David's body is not getting the crucial oxygen required to replenish his cells. This is the explanation as why David's glucose coma scale is not a confident 15. Limited oxygen intakes means he's confused and distressed. This would directly link to clinical decision-making of completing a falls risk assessment on David. There is an increased risk of falls due to dizziness, which is a side effect of his brain and body not getting enough oxygen. That's quoted by Christenens et al. 2020. We're going to finish this assessment by having exposed it all to you with E, which is exposure. In the notes taken by the nurse, Mr. Nazal is febrile but does not give a temperature, which is very poor documentation. Mr. Nazal clearly has a fever due to the viral infection of COVID-19. Olequel 2020 indicates that the clinical decision-making would be to give antivirals and try and keep the patient as cool and comfortable as possible. My nursing interventions. Constantly performing observations and documentation. Performing continuous monitoring of vital signs would be crucial to David's stabilization during his hospitalization. Monitoring these vital signs would entail taking observations and doing an A to E assessment. There's already been a round of vital signs taken upon his entry into the emergency department. The A to E assessment undertaken will be baseline to determine if David has further deterioration or stabilization. After nursing interventions are conducted, David's vital signs, which are monitored continuously, will show if they're back between the flags and out of danger. The intervention also involves detailed and regular documentation of his vital signs. As stated by Sylvie, 2023, record keeping in the form of documentation is a fundamental and essential part of effective safe nursing practices. This allows for deterioration or stabilization to be clearly seen through the documentation of vital signs being performed and recorded. Sylvie 2023 highlights that regular documentation of a patient's vital signs improves the quality of nursing and care provided. My next one is infection control. As described by Lib et al. 2021, there is a direct link between respiratory viruses and exacerbations. This is further confirmed when Young et al. 2017 stated that can also be caused by bacterial infections as well. Ms. Nazal has already contracted COVID-19, which has likely caused this exacerbation he's been hospitalized with. It's clearly indicated the prevalence of multiple respiratory virus can occur during and exacerbate through basic infection control, which fall under standard precautions like the 5 moments of hand hygiene and the proper washing of hands can minimize the risk of further infection to Mr. Nazal. Mr. Nazal, who was an ex-smoker, Young et al. Clearly outlines that this would mean he is a part of a subgroup, making him more susceptible to a whole new variety of infections. As Mr. Nozard already has COVID-19, isolation may be implemented to further protect him and the people around him. Infection control standard precautions should be implemented in all healthcare settings at all times. The next one is administering medication and pharmacological treatment. This is a crucial nursing intervention, with the exacerbation being caused by COVID-19, as put by Oloquilli 2022. Antivirals are the only way to minimize the effects of the virus. Pharmacological treatment, coming in this form of bronchodilators, also help alleviate respiratory distress. As they clearly outlined in the MIMS, bronchodilators help minimize bronchospasms. Young et al. 2017 makes the valid point that medications must be given correctly. Pharmacological treatment must be given by the correct route, either oral, tablet, or injection. Medications must be given at the correct time and routinely. The right medication must be given to the right patient. The correct quantity of medication must be given to the right patient. These are the 5 rights of medication delivery. I'm on to now question 3. Oxygen therapy. As previously stated, I have given the reason why oxygen therapy is necessary. So now oxygen therapy. The assessment of oxygen therapy would be given to Dr. Nazal to increase his oxygen saturation levels. Extravegan et al. 2021 outlines all different ways oxygen therapy can be administered. Nasal cannulas can include high flow, are the preferred option. Other options include simple face mask, face tent, non-rebreather face masks, and ventricle face mask. Etchever et al. Warns that if not necessary, excess oxygenation is linked to mortality. All information from the medications came from the MINS Online Australia 2024. The first 2 medications I'm going to discuss have a lot in common. Salbutamol and ibipramol. Both salbutamol, Ventrol, and ibipramol atropine are nebulizing solutions that would be administered through inhalation. They are both medications that are bronchodilators aerosols. Both medications are short-acting bronchodilators and would be given in acute respiratory distress to relieve the shortness of breath. The side effect of both do include, paradoxically, bronchospasm, headache, palpitation, and throat irritation due to it being inhaled. When administering, contact with the eyes should be avoided at all costs. Salbutamol does cause tachycardic, whereas ibipramol causes GI upset. Pedestrianisol is an adrenaline steroid hormone medication. In the case of Mr. Zal, it will combat any unknown infection that might arise. The administration would be in the form of oral liquid or tablets. Adverse side effects that Mr. Mazal would have to be monitored for are edema, cardiac failure, and hypertension. There are 2 more that are quite similar. Nirmatrol and ritonavir. These are both antiviral agents and would combat the virus infecting Mr. Nazal, which is COVID-19. Both medications would be taken in oral tablet forms. Both medications have the side effects of headache, but niraparib has the side effect of hypertension and hepatitis, while rentanavin GI upset and abnormal thinking. My final one is erythromycin. It is an antibiotic for acute bronchitis and given in oral tablets. Side effects include GI upset and hypertension, and sometimes they're as anaphylactic.
I'm allergic to erythromycin. I took it once when I had a cold. I was 16 and it gave me itching. I mean, everything itched. My legs, my arms, my earlobes, and other stuff too, but I can't.
As Shelley said from the movie House Bunny, she took it and had an anaphylactic reaction where everything itched.